So, good evening, good afternoon, good evening, Brazil. But I'm from Brazil, so I speak much better Portuguese than English. I beg your pardon. And you talk about mindfulness, well-being, and self-care. I will present some concepts and also some research on that. Okay. Let me see. Yes. Just present myself. I'm a senior at a GP in Brazil, associate professor at Federal University of São Paulo, in São Paulo. I'm at the Department of Preventive Medicine there. As Andrew said, I'm a visiting professor at UTS under the supervision of John Adams, also in the School of Public Health. And I'm a mindfulness teacher and trainer, and also the head of the Mente Aberta. We have a special Center for Mindfulness in our university since 2011, and I'm the head of the center. And I also have a company that provides mindfulness training, so it's a kind of disclosure, a mindfulness enthusiastic. And I'm a father of 3 children. They are in Brazil right now. So I will talk about mindfulness first, what we mean about mindfulness. And mindfulness is very popular around the world right now. Have you heard about that? Do you practice? No. That's the challenging to practice. But as mindfulness is popular, we have some misunderstanding about the concept. So I will present our understanding. So for us, mindfulness is not a meditation. That's a big confusion. Of course, we use meditation to train mindfulness, but mindfulness is not a synonym of meditation. We see mindfulness mostly as a mental state when we are aware. So would be the opposite of mind wandering. That's very common. We know by research that almost half of the time our mind is wandering. So in this period, probably you were thinking about something else. That's my presentation. So half of the time our mind tends to be wandering. And so mindfulness would be the opposite of this state, a state of where we are more aware of our experience. So what do you mean by awareness? We mean that we can be more aware of our thoughts, behaviors, physical sensations, and feelings. So it's would be a strategy to be more aware in our daily life. It's the same concept we use in CBT, cognitive behavior therapy, to be more aware of our partner's thoughts, behavior. But in case of mindfulness, we train that by observing the body, as I will show you. But the concept is the same. So mindfulness would be better understandable with this word, awareness. If you go to the research, we have several questionnaires to measure mindfulness, and we can measure how you can be mindful at daily life. We call that dispositional mindfulness. So if I have the skill to be more mindful in daily life, I have more dispositional mindfulness. Some research shows that it has a genetic influence. So about 30% of this capacity is from our parents, and 70% we can train. That's why we are here talking about mindfulness. So it's not only to be aware in daily life, but as being more aware, I can have a more metacognition, as I said, about my thoughts, feelings, and physical sensations. And that allows me to regulate better my emotions, basically. So in the mid-long term, we can deal better with stress. That's our hypothesis. So mindfulness is a mental state of awareness, and we can train that by practice. So we have some techniques to train that state of mind. If you train that regularly, we can develop our dispositional mindfulness. That's our hypothesis. And for that, mindfulness is popular because of this 8-week trainings program. Have you heard about that? So the first program was created in the late 70s, in the last century. And from then, in the last 4 decades, we have developed this kind of training and research on that. So it's a training where we learn to practice and learn to take mindfulness and the skills, the correlated skills to our daily life. So those trainings were created in the health sector, but now we can find in education and workplace. It's very popular. So the way to be more aware is to train regularly, and these techniques are the link with meditation. So the main techniques are meditation. So use some techniques of meditation to train this state of the mind. But the techniques are the way, not the concept itself. Okay. Is it clear? Okay. Yeah. My Brazilian English is okay?
Okay.
Yeah. We have a translator here. As we are in a small group, if you have some question, please let me know. We can discuss that. Okay. So this is a kind of father of these trainings, those trainings, 8-week trainings. John Kabat-Zinn from the University of Massachusetts. So he started with this training in the late 70s, as I said. And the name of the regional training protocol is mindfulness-based stress reduction. So we have lots of this kind of acronyms in BSR. They are related to the protocol, the method we use to train mindfulness. The first population he studied or applied the training was with chronic pain patients in the General Hospital of Massachusetts. And this is the first publication about that. Regarding research, it's not just a pilot study, but if you can read that, he presents the concept, the rationale about the training in this original paper. Another very popular program is mindfulness-based cognitive therapy. That's a mix of mindfulness practice with cognitive exercise from CBT. It was created by 3 psychologists from Cambridge, John Tisdale from Toronto, Zindel Sigler from Oxford, Mark Williams. So this protocol is used inside the National Health Service in UK. So it's provided by free inside the public health system, mainly for mental health issues, anxiety and depression. So we have several of those mindfulness-based interventions or programs. The regional MBSR, this one is very popular in BCT, some for relapse prevention in drug dependence, for example, NBRP, others for relationship, and so on. We have about 100 of those protocols based on this first of John Kabat-Zinn. And also in the psychology field, we have some new psychotherapies that use mindfulness as a component. So, for example, the dialectical behavior therapy that is designed by Marcia Linehan for patients with high risk of suicide and with borderline personality disorder, and acceptance and commit therapy for general anxiety. So are 2 examples of how psychology are introducing the same concept in their psychotherapy. So mindfulness is not relaxation, it's not confusion. When we talk about meditation, it's in general we think what? When I say meditation, what do you imagine?
It's calm, something.
Sitting somewhere, close the eyes, just focus on something.
Yeah.
Try to breathe.
That's a good definition.
Okay.
But other possibility would be to relax. It's not the case of the mindfulness technique. It's about how to focus in our body, on your breathing. So that's why we say that mindfulness is not relaxation. The mechanisms are different. So how does it work? As what you were saying, we use the body. Oh, sorry. Use the body to focus our attention. And so by focus our attention in the body, our mind will wander. That's common. So if you try to follow your breath right now, you will realize that your mind goes to the lunchtime or to the task you have to do right after. So the main technique is to realize that our mind is wandering and return to the body. That's the main technique behind the meditation using mindfulness. So our mind goes with a sound, we realize that and return to our body. So this mechanism will repeat along the practice, and we call technically self-regulation of attention. So the main technique is to use an anchor in our body, for example, the breath. By staying the anchor, we can realize that our mind is wandering. And as I said, it's very common to happen. And we can, with the base of the body, realize that and return to our anchor. So I'm feeling the breath, my mind goes away, I realize that and return to the breath. So we call that self-regulation of attention. This is the basic mechanism. And by that, we develop other skills. One main skill the research show us is the centering. That's the skill, the capability to see our experience with some distance. So we can, for example, realize that we are thinking, not only thinking in a fusion way. We can realize our behaviors, we can realize our feelings. So in a more distance position, we call the observing position. So this will be centering. That take us to this meta-awareness position, to be more aware of ourselves, and facilitates emotional regulation. So for example, in a challenging situation, for example, in a meeting, when some persons make a statement about us, a bad statement, what's the emotion that comes up? Yeah, intense emotion. Okay, if you are not aware, what our reaction? How do we react to that in general? Maybe we reflect back with another misunderstanding word or something like that. So if you are more aware, we can realize that we are under intense emotion, and we can decide or can have a choice about how you behave in front of that. So that's the emotional regulation. So it's the possibility to be more aware of our emotion, to decide what we do with that, and to be able to do that. So they are the three components of emotional regulation. So with this simple technique, we can develop those skills that are very useful in our daily life. That's the hypothesis. And the research, the neuroscience research, shows us that if you do that regularly, we can improve some parts of our brain. For example, the prefrontal cortex cognitive executive functions. The hippocampus relates to memory and to learning. The insula is related to interoception, the possibility to be more aware of all our sensations, feelings. So that is associated with emotion regulation. And also the amygdala, that's a part of our brain related to stress response. So when we are under attack, we stimulate that part of our brain and we tend to react. If we develop a regular practice, we can deactivate this part of the brain, and it can be more connected to the prefrontal cortex. That means we have the choice to, we have the possibility to choose our reaction or our response. Is it okay? And at the same time, mindfulness is not the panacea. It's another confusion. Some parts when mindfulness is more popular, they prescribe mindfulness for everything. It's not the case. So there's some right indications or prescribing for that. Mainly based on our on the research worldwide, we have evidence to apply mindfulness to promote well-being and mental health mainly. So that's our main conclusion about the research. I'll show some of them. This is a graph showing the evolution of mindfulness research, number of papers. So John Kabat-Zinn created the first program here. We have a lack of research for 2 decades, and from 2000 we are having a kind of exponential growing of those papers. So every week we have about 15 new papers on mindfulness, or those mindfulness-based interventions. This is a compilation from 2021. There were about 16,000 papers at that time. Today we have about 18,000 papers of interventions. I will show some summarize. It's a kind of overview of meta-analysis. And all meta-analyses we have show more or less the same pattern. That is, mindfulness is good for depression symptoms and disorders, for anxiety symptoms and disorders as well, for stress in general, when, for example, people with hypertension that are under stress because of the chronic condition, they benefit from mindfulness. For quality of life in general, and for physical functioning, for example, chronic pain, they get more quality of life. Just to show an example, it's a paper published in Lancet 2015 by the group from Oxford. For patients with recurrent depressive major depression, in the phase of maintenance of the treatment, they randomized people to continue with their medication or to quit meditation, start to practice mindfulness. So 200 patients keep their medication, and 200 patients did a mindfulness training, 8-week mindfulness training, and could quit the medication. And so in a follow-up of 2 years, they found that the results were similar. So both groups had less 50% of relapse comparing medication to mindfulness training. So it's interesting that mindfulness training is only 8 weeks. So in 2 years, they kept the results. So it's one example for depression. Another example for anxiety, it's a newer paper, and they compare patients with general anxiety disorder and randomize it to keep the medication, citalopram, or to make a mindfulness program, 8 weeks. and compare in the follow-up, and the results were similar, so the same pattern. So we say that mindfulness is a therapeutic option regarding your situation or your disorder. So you can choose to keep medication, or you can choose to train mindfulness, or you can mix some therapies. In terms of economic evaluation, we also have some research that's showing mindfulness training is cost-effective and cost-saving. Of course, there are variations of the results, but that's why, for example, UK is implementing mindfulness as a tool inside the health system, because it's cost-saving and effective. And also, it's a good strategy to improve mental well-being. This is another meta-analysis, systematic meta-analysis, showing that among several interventions to promote well-being, mindfulness with positive psychology are the best. Among others, mindfulness and positive psychology are the best to promote well-being. So those meta-analysis and research allows the managers, the health manager, education managers to implement mindfulness in their settings. This is the graph. Another area of research is how mindfulness could promote social bonding. That's another risk factor for our health. So you know that to be not connected is a kind of risk factor in the same with the same impact of cigarette, for example. So it's the same impact in our early mortality, and so we have some evidence that mindfulness can promote social connection. And we have some papers that follow up the patients for longer, and we find that if we follow up longer, 1 year or 2 years, the benefits are growing. That's another pattern in mindfulness, because people start to practice in their daily life, and they start to improve their skills by practicing. If you have a longer follow-up, in general, you find a better benefit. Okay. I have more slides, but I will stop a little bit if you have questions.
Mine is general. Is there any study that shows the connection between these practices and those activities in brain, by like taking MRI and fMRI from brain when they are doing the practice? Because when people try to do that, I mean, how you can make sure that they are actually doing these, because we cannot like capture what's happening in their mind, but is there any like facility that we can check their brain image and see if they really do these mindfulness practices or not?
It's difficult to report that. So we do that by questionnaires, by memory, but it's not perfect. We have some neuroscience research on that as well. In learning the technique, we can show some connections that are common to the practice. We can register that. But in mindfulness, we are more interested in mid and long-term benefits. So when we do some neuroscience approach, we are looking for more these mid and long-term benefits, not the immediate effects. Okay.
Yeah, there are some studies as well, like Marcelo was mentioning, that have looked using fMRI. If you're interested in a particular condition, like chronic pain, for instance, where they do the brain scan before the 8-week program and then after the 8-week program, so that you can see a change. And there's some studies showing in change of the volume of gray matter in the brain, in some parts of the brain. They're related to what Marcelo was saying before as well, when he showed the picture of the brain, for instance, in the part where how you recognize yourself in the world. And yeah, that's one part of the studies, but you have to, that sort of studies, you have to choose a particular condition because depending, that will be recognized depending in the brain. And there are some studies using EEG as well to look at brain activation. And that's when they ask a person to do a mindfulness task, for instance. And they have looked at the brain of people that are not trained as compared to people that have been doing meditation for quite some time and how they are able to do that task with more focus and mindfully. So, so there's a few that which is interesting. So,
Generally use more proxies measures, not direct measures. But EEG is a good measure to see the waves, the brain waves.
I'm just wondering if you're always using the breathing techniques to train people. Because, for example, I do a lot of dance, and that whole little triangle is exactly what happens in my classes. Like you have to be very, very present and aware. And if your mind, say you've had a fight with someone at work and your mind wanders in for a second, you miss a key piece. And so you're always doing this.
Yeah.
So I just wonder if you don't always do the breathing, if there's other ways which you use to train someone's mind in that.
Very nice observation. That
Yeah.
We in our mindfulness protocols, we use not only the breathing, we use the body as the body sensations as well in parts of the body, and we use movements. That's the case. And we use also the external sensory experience, for example, to realize the sounds and also the thoughts. And so we use several anchors, but one is movement. So you are right. When you are doing some exercise or physical activity, and at the same time we are aware of our body, it's a kind of mindfulness practice. But it's not the case on average, because when you go to the gym, for example, we are talking, we are reading, and so we are not aware of our body. But if you are aware, it's a kind of a mindfulness practice. Dancing, it's okay. More questions? Just to present some our data, we have a special protocol we developed in Brazil. We call it MBHP. It's mindfulness-based health promotion, and it's inspired by the regional protocols, MBSR and BCT, but we adapt that to Brazilian culture, and also it's informed by health promotion concepts. We use the WHO concept. That means that health promotion is to promote autonomy and self-efficacy. So we use this concept in our protocol. And in terms to promote well-being, quality of life, and also self-care. As we are talking, we use body sensations, mindful movements. When you are aware of our breathing, we call sitting meditation. So, some various kinds of techniques. We also include a self-compassion technique. It's another arm of mindfulness. We call compassion. They are techniques that we can understand as the opposite of self-criticism. Okay, so we promote self-aware with more kind, and we call that self-compassion. And also introduce some reflection values or life values in psychoeducation. So we follow the health promotion concept by WHO, especially from 1986 from Otto Charter. That's the process to promote quality of life in health, including a great participation autonomy in the control of the process. especially development of personal skills. So use this concept in our protocol, and also the concept of self-care. I'm studying self-care here in Australia with John, and so we are integrating more this concept. Self-care is a common sense, but also we have developed some more structured concepts about that, especially when using the healthcare sector. And so our definition is the whole of individuals to prevent disease, managing their own health, and actively participate in the healthcare. So it's related to autonomy, self-efficacy. And we can say that we have two main strategies. So self-care is highly related to mindfulness. So we are using this concept in our research as well. And we know that there are very improvements in terms of health results, increased coverage and access, reduce health disparities, increase quality of service, and so on. So when you use this framework to deliver some intervention, it's more acceptable in terms of healthcare. So we are trying to integrate that in our research. So we have the hypothesis that health promotion, in our case, we are focused on development of skills and personal resources. This can develop self-care capabilities. And health promotion, we can do that in the community, but also inside the healthcare systems. And so we can provide healthcare interventions inside the healthcare systems. And mindfulness would be one of those interventions. So that's our hypothesis, to promote self-care capabilities. So we are researching on that right now. Just to curiosity, we have 7 self-care pillars. We are working on it. One is knowledge and health literacy, or the ability to understand health information and to use that. Mental well-being and self-awareness, another related, directly related to mindfulness and self-agency. Physical activity, healthy eating, risk avoidance, good hygiene, and rational use of service. We have mindfulness studies related to all those pillars. We can show mindfulness can be related, of course, more directly to mental well-being, but also to the other pillars. This is just a kind of structure of our program. It's an 8-week program. Each session has 2 hours, and so they are developed in 2 months. And some just a summarize of our research, if you are interested in that. It's a kind of theoretical framework we are using to study mindfulness. We published this theoretical approach in 2015. And so we are discussing the challenges of implementation, for example, these institutional barriers of funding to promote mindfulness in the health system. And also we are discussing how mindfulness could be delivered in a step care model, or it means that for people or persons with less symptoms, we can deliver less intensity intervention. So it's more implementable in terms of healthcare. It's a meta-analysis we did in primary care as I'm a GP. I'm very interested in primary care. So we show that for patients with chronic conditions, independently of the chronic condition, we can promote mental health and quality of life. So it's a kind of transversal, diagnostic intervention. We had, before COVID, an outpatient clinic in our university. So we receive patients from the primary care system, public health, and we measure the impact of our intervention. And for patients with chronic conditions, we found that they can improve quality of life, anxiety, and depressive symptoms, even post-intervention and also in a 6-month follow-up. Another application for chronic pain. Anita is a specialist in chronic pain mindfulness, but we show for health workers that they can get less catastrophization. That's a kind of mental rumination about the pain. So the pain can interfere less in their daily life. It's another study of college students from our university. We have shown that they can be less impulsive and they perform better in attention tasks, as for example, the stroke test. It's a study we did in Spain. I did a postdoc there, and we compare 8-week standard program to a abbreviated 4-week to see the results. And you see for healthy college students that they are similar. So both groups improved anxiety and depressive symptoms, and there were no different, but in the self-compassion measures. So when you use the 8-week, they can promote more self-compassion. So we show that there is a potential for the stepped care model if you are working with healthier people. It's I studied with primary school teachers from Brazil, and we were looking for some mechanisms related to biomarkers. And we compare mindfulness, our protocol, to a neuroscience psychoeducation with the same intensity. And we show that mindfulness is better improving perceived distress, resilience, affect, and quality of life. And also to lower circulating IL-6, a kind of pro-inflammatory biomarker, and diminishing the GS agencies that are anti-inflammatory or antioxidant biomarkers. So we show that those biomarkers can be a potential mechanism to explain the results for this population. We also have some works with police officers in Brazil, several states of Brazil, and we published this in the last 2 years. And we show that they can improve quality of life, mental health symptoms, and they got less operational stress and burnout symptoms as well. And on the other side, they got more resilience in life purpose in their work. So the both sides of mental health, so symptoms and positive capabilities. We also have some studies with older adults. It's one example. We compare mindfulness, our protocol, to be in a digital inclusion program. They develop digital game by themselves. And in this case, the digital inclusion was better to promote quality of life, and mindfulness was better to mental health and to a better sleep quality. So they were different. We also have studies with some athletes from Brazil. This is a Paralympic Brazilian team for Tokyo, and they got our protocol, and they had improvements in sleep, in mental health, and also we had luck they have the better performance, the best performance in the Olympics after the training. So it was a good result. It's a big study we did comparing a general mindfulness program to a mindful eating program. Mindful eating program, it's especially for people with binge eating or with problems with eating, and we compare both for overweight women and low income overweight women in Brazil. And we found that in this case we had 2,284 patients with body mass index between 25 and 40, and we compared the two 10-week intensity programs, one general, another mindful eating, and we found that both showed improvements in eating behavior and in the reduction of binge eating, but the mindful eating program was better in terms of effect size when compared to a general program. But the general program is better in terms of compliance. So it's easier to follow. So they are different as well. We are finished, don't worry. And we do also qualitative research, and regardless of the quantitative results, it's very common to find this kind of reports that patients or people in general got transformative personal experience, enhanced self-awareness, and they could integrate mindfulness in their daily lives. We are with some new projects. We are trying to integrate mindfulness with life purpose and life meaningful life. This is a protocol in collaboration with Spain. And so this guy is an actor, and he's bringing philosophy and arts integrated to mindfulness to promote a meaningful life. So we are research on that as well. And also we are starting to use a more implementation approach to implement our interventions into the health system. Now we are, an example, we are integrating mindfulness in the primary care by a stepped wedge randomized clinical trial. So just to see also the challenges in implementation. As I'm studying self-care, we are running a systematic review and probably a meta-analysis to see if mindfulness-based intervention can have an effect on self-care behavior. So this is another ongoing project. Lots of limitations and future research, mechanisms, long-term benefits, and the real-world implementation science approach. Mindfulness is very popular. If you have an iPhone, you can address mindfulness apps in it. And also is popular, becoming more popular into the public policies. For example, UK has a specific public policy for mindfulness. As I said, they have mindfulness training inside the health system, the public health system, since 2004. And since 2015, they are introducing mindfulness in primary schools as well. There's a report on that from 2015, and now a new one last year. And you can find some compilation of the research here, and also they are implementing mindfulness in their societies. This is the picture of John Kabat-Zinn inside in front of the Prime Minister. They are visiting the Prime Minister this is a member of the Parliament. So they are very advanced in terms of public health implementation. That's it. It's our website in our university. It's our website of our company. We have, if you wanna hear some mindfulness practices in Portuguese, you can go to Spotify. And these are my contacts, so I'm available to your question to send materials. Thank you.